if I had to pick one thing that is most important facet of health, it would be sleep. Because it literally impacts everything. So making that, it makes you more resilient. I know when I don't sleep well, I'm shorter with people. I'm not nice. I can't think straight. I'm not as productive.
Welcome to the Blue Rose Podcast. I'm your host, Becca Blue Rose, a runner, storyteller, and believer in creating a life that feels like your own. Some weeks it's just you and me, and other weeks I'm joined by women who are chasing their own version of a bold, unapologetic life. Together we explore what it really means to take risks and trust your own path. Today's guest is Danielle. Danielle is a unicorn in the women's health space. With 12 years of experience as a licensed physician's assistant, Masters of Science in Counseling Psychology, and certificates as an FDNP, fertility educator, nutrition coach, and personal trainer, after 10 years practicing conventional medicine as a physician's assistant, she shifted her focus and pursued certification as an FDNP, where she now helps women optimize their health through lifestyle and deep dives into their health. She is the founder of her companies Empowered Mind and Body, Empowered Medicine, as well as the co-founder of Unconventional Collaborative, a virtual mastermind focusing on supporting practitioners, coaches, and trainers to elevate their practice. She is a lover of dogs, all things outdoors, movement, and an avid trip planner. She is perpetually in search of the optimal health, and what she can tell you is that the definition will continually change through seasons of life, but will likely continually include regulating your nervous system, quality connection, play, movement, and good sleep. Please welcome Danielle to the show.
Yeah, I'm Danielle Kepics. I am a board certified physician assistant of 12 years. Prior to that life, I was a mental health therapist and personal trainer. I also hold certifications in fertility awareness, fertility education, used interchangeably in those terms. And I'm also a functional diagnostic nutrition practitioner, which is a pretty hefty certification program, anywhere between I finish it in about 8 months. Most people take about 2 years to do it, but I kind of, I flew right through it. But it's a little bit of everything all rolled into one is how I describe myself for the women who work with me. And aside from all of the boring certification stuff, I love the outdoors. I love dogs. I love dogs, and probably an unhealthy amount. Uh, so much. I hate being cold so much that I live in the desert, but I also hate it here for 2 months out of the year. So I live south of Becca in St. George, Utah, with my boyfriend and our 2 little fur babies that I don't know if you do video, but you'll see. But if not, the people might not see. But if they visit my Instagram, they will see them. Great.
So, yeah, I love it. So along this journey, because obviously you've done a lot of different things and you've done a lot of different certifications and whatnot, what kind of helped you find your passion for helping women and helping them realize that all the things that we're told, I'm tired, I've tried everything and I can't lose this weight, or I'm moody and I don't understand why, or my hormone tests are weird, but everyone just tells them it's fine. And kind of how did you step away from that narrative and kind of develop this passion for helping women?
Yeah, so that's a really great question. So around 2018, actually, let's take it back a little bit before 2018. I think you and I talked a little bit when you were on my podcast, which was such a really great episode. I'm really excited for it to air. I had a period of what I call macroing too hard, orthorexia, that went on for about 18 months. And I was always a girly who was I was eating more than men. I would put down the food. And then, I got into CrossFit and everybody was counting macros and I was like, I'm going to do this too. And I'm very competitive and I macroed real hard. And anyways, when I finally learned about what I was doing to myself was not actually in the name of health, I started like the Instagram algorithm, even back in 2016, was algorithmy. And it was sending me women like Jolene Brighton and Carrie Jones and Nicole Jardim. And, I heard Jolene talking about, she's the author of Beyond the Pill. For anyone looking to get really true informed consent about birth control, I highly recommend Jolene and her book. She's also an amazing advocate for endometriosis and adenomyosis. Really, really amazing resource. I will drop probably a lot of other names in this podcast
Amazing.
because we all have I don't have any scarcity mindset, and we all have such amazing things to give. So I found Jolene, and I was like, I had a Mirena at the time. For people who don't know what the Mirena is, it is a progestin, not the same as what your body makes progesterone. Progestin containing IUD. It actually contains the most amount of progestins as all of the IUDs. And I had one at the time, and I was like, wait a minute, what? Like, just hearing, and IUDs are different from OCPs, are different from hormone replacement therapy, et cetera, et cetera. But just hearing the things that she was saying, I was like, why did no one ever teach me this in physician assistant school? I was so mad. I was so big mad. And just learning about how, the bleed on birth control is withdrawal bleed, and it's shutting down all of our hormones. And for anyone listening, without me going into the complexity of this, is what the birth control pill is doing is it actually is like taking away all of a man's testosterone. And we would never do that, right? Like, we would never be like, let's just chemically castrate you. It's literally chemical castration. And so once you see the thing, you can't put the toothpaste back in the tube, right? And then when I started consuming all of that content and all these other books I have over here, it was just so glaring to me that women were being underserved, dismissed, gaslit, and I'm like, whoa, like, what are we doing to women with the birth control situation? And I am not, to be very clear, I want to be clear at the beginning of this episode, I am not anti-birth control. I'm pro-informed consent. And women are not properly consented when they're told, oh, just go on birth control for your acne. Oh, just go on it for this. Oh, just go on it for that. And it's like, whoa. Like, our hormones are actually important to our health. You have receptors on every cell of your body, in your brain, in your eyes, on your skin, in your gut, for estrogen, progesterone, testosterone, which is a highly under-discussed hormone that's really important for women as well, right? And so, that just isn't discussed. And so when I started seeing all of that, I was like, I gotta go. I gotta get out of this. And, I was doing travel PA work at the time, and it took me a couple of years to kind of like really just kind of get my footing in it and decide like what I wanted to do about it. And, I started my podcast, Strong and Unfiltered, in 2020. It was a pandemic baby. And after that, I think everything was pretty far downhill there. Like, it was, my business actually started as like, I wanted to continue to work in conventional medicine, and, make a difference. What I wanted to do was help people learn how to talk to their doctors. And that's really what my business started as. Like, here are the questions that you need to ask. These are the blood tests and, that type of thing. And I just wanted more and more and more and more. And so here I am.
I mean, it's so true though, because like even just like an example from myself was I recently just got a lot of hormone testing done, and I remember I went in. This is like a longer story, but I was bleeding for like 90 days straight. And I went in and I told my doctor this, and she just said, it was like, she found out that I was an ultra runner, and she told me that that was why I was bleeding. She's like, well, that's the problem. Like, you'll just have to like wait it out, essentially. And like, well, because I think I had stopped bleeding by the time I went in. So she's like, well, you're an ultra runner. And then she asked me 6 times if I was on birth control, and I said no. But then I wanted to do hormone tests. So I got my estrogen, testosterone, and progesterone tested. But like, there was so many other things that, like, I should have maybe asked or talked about, but I just, like, even now, I was like, I don't even know what to ask this woman, because like, even walking in there, I could tell she had one solution for any problem that who came in, and it was, "Are you on birth control?" And when you said no, she was like, "But why aren't you on birth control?" And then
I
she's
don't know
like,
what to do.
yeah, like, literally, and then I was like, "Oh my god," and then I just, like, gave up. Like, I was so mad, and I was like, "I quit going to the doctor." Like, going to the doctor is the worst. It's just the worst. And it's a
Yeah.
lot of
And I mean,
money.
that's honestly, that's the experience that a lot of women have. And that's how a lot of women get into my hands, so to speak, is that they're just so fed up with being pushed pills, procedures, and potions by conventional medicine. And again, there's a time and a place for
Mhm.
those things. But when you're bleeding for 90 days and you just don't, there are 1,000 things that I can think to work you up for and test you for and suggestions to make. And it's like,
Mhm.
it's most, not all, but a lot of conventional doctors are one-trick ponies. They don't understand how to talk about nutrition. They don't understand how to talk about lifestyle, stress management. Like, I just got a sleep test back from a patient today who she's 44 years old. I did a hormone strategy session with her. This is what I do before I start HRT with women for people who that's kind of the area that I specialize in. I'm quite older than Becca. I'm 42. And so she's 44 years old. And I looked at her intake form and I'm like, this woman has sleep. Like, if she does not have severe sleep apnea, I would take it to Vegas. Like, I would bet on it. I would throw it all on black, like 100%. She's, her test results came back today. She stops breathing 41 times an hour. And no one ever
Whoa.
asked her about a sleep test because people don't think that women have sleep apnea problems. They don't think of it as an airway problem. They just think, oh, if you're a fat man with a thick neck, like maybe we should get you a sleep test. Like, women are so, it's just another way that women are like overserved and underlooked. Like, it doesn't usually show up as snoring for women. It shows up as restless sleeping. It shows up as anxiety, hypertension, allergies. Grinding your jaw. It's not stress, ladies. It's not you have an airway problem and you need a sleep test. And I know we were like talking about hormones and stuff, but this is just such, I was just telling my boyfriend about this before I got on this call about this test result that I saw. I'm like, she's 44 years old. No one ever screened her for an airway problem. It's unreal
Mhm.
to me. And it's just because women show up, even thinking about how women show up with heart attacks. With men, it's like, oh, my chest hurts, I have left arm pain. And with women, it's acid reflux. It's I feel tired, I feel nauseated. That could be a heart attack. And women get dismissed and they die. And so
Mhm.
it's because we don't study when we just think women are tiny men and we're not. And it's disgusting, to be really honest. It's just women were not required to be studied by the National Institutes of Health, which is where a majority of our research comes from here in the United States, until 1993. Like, were you even born yet?
Yes. No, actually, no, I wasn't. I was like, yes, I was. Literally, no, 5 years later, I was born.
Like, it's unreal to think that like I was 9 years old and we were still not required to. Now people were, but not like we do now. And what we do now isn't near what we need. And it's because tying it back into the hormone situation, researchers don't want to deal with the menstrual cycle variabilities. So when they study women on birth control who don't have cycles. How
'Cause
mad
it's
does that
easier.
little piece of it? Yep. Big
Yeah.
mad.
I think I've
So,
listened to quite a bit of Stacey Sims, and, like, she talks a lot about that kind of stuff, and I feel like that's where I've heard that and just, like, her research, and it is just fascinating, but even what you said when you're like, "Oh, I was talking about hormones," but I think essentially you're kind of always talking about hormones, like, I think
yes.
that's maybe something that people don't realize, and maybe you can speak on this a little bit, is, like, how everything is connected, like, it's like my gut, my hormones, like, if I'm not sleeping, like, that's connecting to my hormones, what I'm eating is connecting to my it's like everything
My God.
is
Everything.
a hormonal problem.
Yes. And what I like to tell women, I think that's something important to mention is that a lot of women come to me and they're like, oh my God, my hormones. Oh my God, my hormones. And I'm like, yes. And also, that's the tip of the iceberg. All of the problems underneath are what's causing you, are are causing your hormone problems. So it kind of comes to the surface, right? My friend Carrie Jones says, who's also an amazing individual to follow for hormones. She always says, like, hormones are like Mariah Carey. They're dramatic, the first to leave and the last to come back. Like, they just take a lot of love and nurture to like
Yeah.
they the drama. And so, but I think that's really important is that, like, if you're screaming about a hormone problem, you have another problem causing the hormone problem. Like, hormone problems don't just happen. They react to things, but they're really sensitive bunnies. And so one big way that we can talk about how hormones are interconnected with all the body, I mentioned earlier how all the cells in the body have receptors for all of our hormones. So that's the first way. The second way is, let's take estrogen. I know she gets a lot of attention, the va va voom hormone, as I've heard it put, but that is really detoxified through and metabolized is probably a better word, through our liver and our gut. So we have like phase 1 and phase 2 happen in the liver. So a majority of like that estrogen metabolism happens in the liver, and phase 3 happens in our gut. So guess what happens when you're constipated? Guess what happens when your bowels aren't good? Guess what's happening when you're drinking too much alcohol and treating your body like a dumpster fire? Your estrogen is not getting metabolized properly, and then it has to get recycled, and then it gets clogged up, and then all these women have these quote unquote estrogen dominant symptoms, which I know is like this buzz term and whatever, but you can have high estrogen. So you get all these high estrogen symptoms like, oh my God, my breasts are so tender, I have heavy bleeding, I'm moody, I'm irritable, I have migraines, things like that women are complaining of. And it's like, okay, like, but you're having 5 glasses of wine a week, or you're having 2 glasses of wine a week, and you're not pooping because you're so stressed out, right? You want me to bring the nervous system into this? We can bring the nervous system in. You're so stressed out, so you're not pooping, right? And then when you're so stressed out, you're not sleeping. And then you make worse nutritional choices. You don't have the energy, so you're not exercising. You're not building muscle. That affects your metabolic health. Like, how many more ways? Like, I can tie it in however many ways you want. Like, it's so connected, and all of that stuff supports our health and our hormones, right? Like, anything that supports health really supports hormones. Because like you said, it is involved in every system.
So then if someone comes to you, how do you like decipher what is
Ooh.
going on? If like, okay, so like, what if I'm having all of these issues? I'm like, you know what, Danielle, I'm not sleeping.
Yeah.
I'm moody. I'm tired.
Yep.
My boobs hurt and I'm like gaining weight or whatever. And it's like, where do you even begin to help someone? Because that feels very overwhelming as
Yes,
a
I love
woman
this
to be like,
question.
yeah,
I'm like so excited right now. I love this
I love
question.
it.
So,
I love it.
first of all, like any good clinician, I'm going to say it depends where I start with you, because every person is individual, right? And second of all, I will say that I have the most comprehensive intake form of anything that you will ever fill out about your health in your life. I will ask you anything from were you breastfed to like about your mold exposure. Do you have symptoms of MCAS? And I have a screener for MCAS, histamine, endometriosis, pelvic floor issues, airway. And if you were breastfed, do you have breast implants? Do you potentially have Lyme exposure? Like, I literally ask everything. I have had women say to me, you know more about me than I know about myself, and you know more about me than my husband does now from my intake form. So I really start with my intake form. And beyond that, I'm always assessing the basics first. Like, you cannot build a foundation with straw. Like, you can't. Like, if I give you screws and a hammer and I give you no wood or brick, like, you can't build the foundation of a house, right? So I have not worked with a woman that I have not had something in their foundations that needs tweaked. And when I say foundations, I mean their nutrition, their exercise and movement, hydration, sleep, stress management, their work environment, their relationships, their mental health, things that bring them joy in their life, right? So many of my women they have DTFM, right? So all really serious diseases have acronyms, right? So doing too fucking much is that acronym. Okay. Doing,
Yeah.
girl, sit down. Girl, sit down. Okay. Listen, it's different in your 40s. It just is. I wish that it wasn't. Like, I don't make the rules. I would like to speak to a manager. Most of the women that I work with are highly successful type A women, ages 30 to 50, and about 70 to 80% of them work in a healthcare related field. The other 20% are like stay-at-home moms, teachers, in finance and corporate and things like that. But they're doing too fucking much. They're over exercising. They're under eating. They have too many responsibilities. They're trying to do 62 things and be 100% at all of them. And I get it. I get it. And so a lot of it is dialing back and finding like, okay, where do we need to pull back on that? A lot of my women, I've worked with women who have been drinking too much alcohol. If you're drinking any alcohol at all, I'm like, we need to stop immediately, and we need to do that for at least 90 days. I saw, I don't know if you're probably too young for her, but she's a menopause, personal trainer, influencer. Her name's I think she's Beth Cora Fitness, but she was like, y'all in fucking perimenopause, you need to put the drinks down. You're the fucking problem, okay? You are the problem. You're bitching about all these symptoms, but you want to keep drinking your nightly wine. Like, you're the problem, and I don't feel bad for you. So anyways, I bring that up to say, like, not to be a dick, but like, if you're drinking alcohol and you don't feel well, and you don't want to stop drinking your booze, you're the problem. Cue Anti-Hero by Taylor Swift, like you are 100% the issue. So alcohol is a
Okay,
big
wait.
one where I will pull back.
Before we move on from alcohol, I do just want to ask, right? Okay, because like there is this. I want to know your perspective on like, right? There is this like movement of like, right, like balance, and like I can have a glass of wine, and I don't need to restrict, and all the things. So, do you think that no one should ever drink alcohol, or is this like I am resetting and building my foundation,
Yeah.
or it's like you can drink alcohol,
Yeah.
but just know it's probably the problem?
So this is a great question. And I think, again, like birth control, I'm pro-informed choice,
Mhm.
right? Like we need to understand what we're doing. Alcohol is a class 1 carcinogen. So I think if you are drinking any amount of alcohol and you are having symptoms, let's pull it back for 90 days. Let's see how you feel. Okay. Second of all, I give all of my clients who are, if they're consuming alcohol at all, which many of my women don't actually, there's a really great Huberman episode on alcohol. It's very I would call it clinical. So there's no like emotion involved, and I think it's a very good informed consent conversation of it, do I want to put this in my body? Which I
Mhm.
think is a really important thing for people to be able to make decisions, right? Like I want people to be educated and have the information. I got no judgment on what you want to do with your body. However, if you come to me and you're bitching about shit and you're drinking alcohol, I'm going to call you on it. So as far as down the line with alcohol, like I mean, for me, I'm never going to say like, oh, I'm never having a drink again. Listen, I love the taste of alcohol. I love a good IPA. I love a good whiskey or bourbon. I haven't had a drink in 2 years, almost, because I hate how I feel. Why am I putting that in my like why do I want to put that in my body? It doesn't align with my goals. It doesn't align with who I am or the messaging. Like it feels very incongruent at this point. And
Mhm.
I think, I had a client ask me once, and we've cut her alcohol down, I would say by 80. She was having a drink or two almost every night. And she has really, really cut back, and I'm super proud of her. And she said to me, how do you just not drink alcohol? And I go, it's just not a part of my life.
Mhm.
Like, I don't go out to bars. I don't go out to clubs. I think we actually still have some in the house, but like I don't hang around people that like that's what they do. And so it's just not something that I think about. Like it trashes your sleep, it trashes your nutrition the next day. Like I don't know. Listen, if anyone listening to this has ever had a couple of beers and craved lettuce, I would like to talk to you. Send me a DM. Like and the next day, like you don't feel good, you don't move, you don't exercise, maybe you don't get your meal prep done. Like and I'm not saying like, oh, you go out for your anniversary dinner and you want to have a drink. Like that's different. So I
Yeah.
do think that there is room. And also, I want people to understand that this is literally a class 1 carcinogen that you're putting in your body. And I just think that like we have been warped in our culture to think like it's okay to be afraid of the sun and take birth control and like eat like shit and sit on our ass. And like we've normalized all of this. And I think alcohol and, everybody's like, oh, Gen Z like has the lowest tobacco rate in alcohol. And I'm like, they're all vaping. That's
Yeah.
why. None of them are
Yeah.
drinking because they're all on synthetic fucking chemicals through a pen.
Yeah.
So
There's always something.
I know there's
There's
always
always
something.
something.
And again, I am very pro free will. Free
Mhm.
will. But I also just it goes back to the everything goes back to the birth control thing for me is it's like I as a medical provider had no idea. And so how does the average, not that women are stupid, but like how can someone just sift through all of that and be expected to know all of that when they don't have a medical degree? So I really want people to have the information. And if that's how you want to live your life, I'm good with that. Like as long as people are getting that information. But I just think that there's a lot of ways that and pieces and places that people and especially women are not getting the chance to make a true informed decision about the medications they're taking, the things they're putting in their mouth, etc.
I feel like I would be, um I feel like you talked about this a little bit at the end of your podcast, and I feel like it would be a miss not to ask you your opinion on GLP-1s, since
Mm.
it's, like, the most popular thing in the
Yeah.
world right now.
Yeah, I fucking hate them.
Great.
I mean, I
Tell
can
me why.
extrapolate on that. So
Yeah.
here's the thing. I think that there is a time and a place. I actually just had a client who definitely, she just got off her IUD about 6 months ago. And she's talking to me about her symptoms. I'm like, I actually think you might have PCOS. And she's telling me about the weight gain that she's experienced, and she is putting in the work. She's my client who also has reduced her alcohol intake by like 80%. She's eating healthier than ever. She's sending me pictures of her meals. She's hitting the gym, and she's like, I'm still gaining weight. Okay. I said, I think you should have a conversation with your doctor, like with your prescriber about a GLP. I think you should. Oh, I tell that story just to say that, like, I am not 100% opposed to this, but I think the way that it is being used, and I feel the way that women are being preyed upon, because you see fucking videos of people injecting them their 8 packs to get a 12 pack, or I have inflammation, or I also think it's a lazy way to lose weight. And I also think it's pharmaceutical anorexia in a lot of cases, because the people that I see injecting it look like me, or they're thinner than me. And I don't think that we should be allowing influencers on the internet to peddle medications that should be prescribed by a doctor. And they continue to prescribe these medications for women who are underweight because they're afraid of the Press Ganey scores, which are their patient satisfaction scores. Because when you say no, a patient complains and you hear about it. And I get it. It sucks. That's a pain in the ass. But you know what? Practice good medicine. Like, you're literally creating an eating disorder in someone. These doctors don't know enough about how to screen for eating disorders, what they actually look like, right? They just think like, oh, and I mean, I have a girlfriend who works in concierge medicine, and she has a doctor who's prescribing a GLP for a woman who's 90 pounds. What are we doing with that? That's a real story. Like, that is a firsthand, like, I know this person,
Yeah.
like, who works in that office, and she said no. And the prescription got sent to another practitioner in the office, and someone else filled it. What are we doing here? And if you think that
Yeah.
that is a one-off, I promise you it is not. I promise you. I think that I have a lot of problems with the GLP-1s. I do. I think that, I've worked with, over the past 3 years since GLPs have really exploded, I've worked with hundreds of women, and I have suggested it to 3 people. And I think that the number of people who are on them, like, a really popular fitness podcast that I listened to, Mind Pump, the one host, he was saying, like, I got together with some of my non-fitness friends and they were all on it. All of them. What are we doing? Like, it's really, really crazy. And I just think that it is a pharmaceutical, and there is a time and a place, and it's also being bastardized. It's being overprescribed and undersupported. There are no conversations about what does your diet look like? What is your dieting history? Do you have an eating disordered history, right? Like, these women, it's like bringing back out the eating disorders in these women who have healed their issues, and it's preying on them, right? Like, are you exercise? Like, these basic conversations are not happening. Referrals to dietitians are not happening. And in my opinion, a referral to a dietitian and a mental health specialist, because why are so many people obese? I personally think there is a huge, huge issue rooted in trauma with obesity, and how people eat and treat their bodies, and abuse and neglect. I mean, that's a very large, much bigger conversation. But at large, overprescribed, undersupported, 1,000%.
Mm.
That was a
Yeah,
really big
and
mouthful.
no, that's okay. I mean, I think that, yeah, they have been around for a while, but I just think recently, like, I was watching Disney Plus, and now on Disney
Oh,
Plus
yeah.
they have like
Right.
GLP-1 commercials, and I'm like, this is crazy. Like, I cannot believe that I'm on Disney Plus right now and this is what I am seeing, and that everyone is on this. And then, yeah, it just makes you think about, like, well, like, even for athletes too, it's like, okay, well, like, I don't know, like, the science behind how it affects people as, like, an athlete, but even just thinking about,
Oof.
like, if you're not taught how to,
Oh,
like, eat and, like, work out, then how are you supposed to maintain these results? Like, are you gonna inject yourself for the next 70 years? Like, that doesn't feel like it's healthy.
yeah. There's no stop button. There's no discussion about, hey, when are we going to stop this, and how, and like, what's the end game plan? And as far as an athlete, so GLP-1s work, they work in a lot of ways, but they slow your gastric emptying is one of the things that they do. And so if it was an athlete, I mean, first of all, like, there's going to be an osteoporosis, which is a low bone density, which is what causes hip fractures in late age. There's going to be an epidemic of that in about 15 years, if not sooner. And nutrient deficiencies, right? We're slowing gastric emptying. Things are not going through as well. People are not eating as much, so they're underfueled. And so any of the symptoms that you're going to see of, like, low energy availability or REDS, right? it just it's really scary, and for people out there who don't know, you're all probably pretty far away from the age of 65, but if you have low bone density over the age of 65 and you have a hip fracture, you have a 25% risk of death from a complication after that hip fracture. So that's how serious frailty really is for your health.
Mhm. So what is the importance? I know you talk I think I saw something about you talking about, like, an iron supplement, and
Mhm.
I am curious, like, what so,
Yep.
like, speaking of, I'm not even just talking about GLP-1s anymore, but just, like, in terms of, like, supplementing and minerals, like, right? Like, we have people telling women to take, like, iron supplements, and then we're taking like, different vitamins, and there's so many things that we're told to be taking, and it's like, what is your kinda method when you're prescribing different vitamins, different minerals, and how we keep our bone density up, how we keep, all of wow, this is, like, not a great way to word this
I
question,
know
but
exactly what
I
you're
think you
saying.
get the point of the
Yeah.
question.
Yeah. No, you asked it just fine. No. And so the two biggest components to having strong bones are the same things that really give us strong muscles. So number 1, we need to strength train. And number 2, you need to eat enough calories. I don't know how many women I've seen over the years who have strength trained and they're like, I don't understand why I still have low bone density. Well, girl, you've been dieting as long as Oprah. So like if you are someone listening to this and I don't know, like what your age range is, but if for some reason you've had a DEXA scan and you can get these cash pay if you're concerned about this, like there's like I got a DEXA scan for $50 last summer. So you can do it fairly cheap. But if you exercise a lot and you're like, I don't understand, everybody says to exercise for bone density, and you come back like as osteopenia, which is pre-osteoporosis, you are probably under eating. And or you're a cardio bunny and you're not weightlifting. Like weightlifting is the I don't know. It's a tie between like eating enough and strength training. Like you need both. No amount of women are peddled like calcium and vitamin D, and listen, like get your vitamin D tested, ladies. Like it's 94% of the country is I think it's 94 or 96% of the country is deficient in vitamin D. And it's really, really, really important, which is a whole other conversation. Extra calcium is probably not what you need, and it's probably just going into your arteries and creating that like stiffening in your arteries and like a whole bunch of other fucking issues. So, like giving a woman a calcium supplement when she has low bone density and allowing her to continue to diet like Oprah is literally like giving someone a band-aid when they need surgery. Literally.
Okay.
That's
I
how
love all
stupid
your,
it
like,
is.
metaphors and similes, and it's awesome. I love it. And it's important that women hear this and that they hear different perspectives from different people and, like, they don't just, like you said, like, they don't just take their doctor's word for, like, "Oh, yeah, I should be doing this or I should be doing this." It's like, no, like, do your own research, but like you're saying, it's definitely difficult when you don't like, I don't have a medical background, and so learning all of this on my own is definitely difficult because you have 10 different people telling you 10 different things, and you don't know it's kind of like trial and
Yeah.
error too, which also just
Yeah.
sucks. It's like, "Oh, I'm gonna try this, and if it doesn't work, then I'm gonna try this," and it's just a whole process, so
Yeah. I think, one of the things that I'm really passionate about is like, if you can't find someone credentials in their social media profile within like 2 to 3 clicks, they probably don't have any. You should probably run. Like, like, it's just it's so ridiculous out there, and it makes me so mad because some of these like really prominent people. I'm like, you have a degree in journalism. Why do you have 1.1 million followers and you've written a book about food? It's just
yeah.
those things are really, really wild to me, and I'm not saying that those types of people can't have like James Nestor, who wrote Breath, he's an investigative journalist, and he wrote a book, but it was very from, like, a journalist perspective about, airway health and breathing and things like that. So, I'm not saying that those people don't have space to, like, tell their story and give their opinions and things like that, but I'm really, really over, like, I healed my trauma, so I can help you heal yours. Like, that shit's dangerous, 'kay?
Yeah, and it's one thing to, um, come off as, like, an expert versus, like, being open and honest of, like, "This is my experience," and share. But I do agree with that. Is like it's definitely really hard because everyone on social media these days is an expert, and then you see things going around, and you're like, oh, like that is that like, and that's what's crazy to me is like fact checking. I'm like, do people like fact check anymore? How can women find the balance of
Yeah.
like this is what feels good and healthy and aligned for my body to like what is too much? And is that
Yeah.
different? Is too much different for everyone?
Yes, 100%.
Okay.
So I like to say I talk about the stress bucket a lot, and people don't like lots of things are stressors that people don't think about. Like exercise is a stressor, right? Like there's financial stress, there's relationship stress, there's the person who cut you off in the car. I mean, there's just aging parents, sick siblings, sick loved one, job loss, getting a new job, getting married, getting any kind of change in life, right? So it depends how much capacity someone has depends on how full that stress bucket is. So, a lot of my women come to me with very full stress buckets before we even get to, like, exercise, right? But before we even get to the exercise piece, like, I have a lot of moms of young kids who are postpartum, and postpartum depletion is a whole other conversation and needs hours and hours. And I know a lot about it, but I wouldn't call me an expert in that area for postpartum. So if you're interested in that, I can point people in other directions.
Mhm.
Um, but they've got their moms, so they've got one or two kids at home. They have a full-time job. They have, a significant other, a husband, a partner, whatever, and they're not sleeping, and they've got sick parents. Like, I have one client right now who flies back to Ohio, several like, once a month, and that's, air travel in and of itself is a stressor on the body, right? And then these people are trying to run marathon. I mean, not to, like, shit on, whatever, but when you've got, like, all of that going on and, like, young kids, right? Because you can train for things with children. I'm not trying to say that moms can't do those things, but when you've got a 2 and a 4-year-old at home and you're working 40 to 50 hours a week and you're dealing with parents and trying to coordinate schedules and you're trying to like run 50 plus miles a week, it's probably too much on your system. Sorry, not sorry to deliver that message to people. Like unless you have all the help in the world, like there are always the exceptions, right? So it depends on how full that stress bucket is. Like your stress bucket is very different. Yes, you have a job. Yes, you have a partner. I don't think you have children. Um, and so and I don't have kids either. Like it's just different challenges and different strokes, but it's just not something that I have to deal with. So I have more time to allocate in other places than a parent does. That's just the bottom line. So do you, right? I'm 42. You're what, in your late 20s?
Yeah, I'm 27.
Oh my god. I mean, like, I was competing in the top 1% in the Mid-Atlantic region in CrossFit regionals when I was that age, right? And I was pounding my body really hard, and I still work really hard, but listen, it's just not the same in your 40s. So, hormones are fluctuating and, you know, there's just different factors. And so it really, again, like I said at the beginning of this podcast, any good clinician is going to say it depends. And then the other piece of that puzzle is like, what does your lab work actually say and what symptoms are you reporting? Right? So like if you're telling me women don't come to me because they feel good, right? So when you're telling me that you're constipated, you have diarrhea, you're not sleeping well at night, your energy is shit, but you're training for a marathon and you're working out 6 or 7 days a week, like, or even if let's take the word marathon out. Let's say you're doing CrossFit. Let's say you're lifting weights, 6 or 7. It's too much. You're doing too much. And sometimes too much for people is 2 days a week of exercise, depending on how full that stress bucket is. Like it really just depends. And I mean, we could get into the whole other conversation of just like nervous system capacity and like people are created different. Like I have a really high capacity for things and some people don't. So
Mhm.
it just depends. But when you come to me and you tell me you've got symptoms and your blood work and your GI map is lighting up like a Christmas tree, but you want to keep running ultra marathons, I'm like, you can do that, but you gotta keep not feeling good. We need to heal this shit.
So then, okay, so So a lot of what people that listen to this podcast, I wanna say are probably like 20s, maybe early
Yeah.
30s, but like this is
Yeah.
kind of like the period we're in. And so if you're talking that I'll just use me as an example. So if I came to you, Danielle, and I was like, "Well, Danielle, I'm training for a 100-miler and I don't
Uh-huh.
feel great all the time, but I'm not going to stop training for my 100-miler."
There's still
It's like,
things you can do.
yeah, and I guess that's the question there is because, right, like, I'm making the choice to know that, like, probably training for a 100-miler, no matter who you are, at
It's
what phase of it's, like, a
yes.
lot. Like, your body is
It is.
probably
It's a
not,
lot.
like, meant to do that all the time. Um, so then it's like, okay, yeah, or you have someone that's coming in and they're like, "But I like doing this and I'm not gonna stop." Where do you start with them in terms of, like, okay, fine, you don't have to stop, but, like, what can we do to make you feel less bad while you're
Yeah.
doing this thing?
Great question. So the first place I'm going to look is nutrition. You and I talked about this. Like I loved hearing how much food you ate because if you're training like that and you're not willing to eat more food, we're going to have a really hard time working together because there's not you have an energy mismatch and things are going to continue to get worse, right? Like it 100 miler is going to be taxing on your body no matter what, but you can do it smart. You can do it in a way that like is not going to be as taxing on your body, which sounds like so stupid to even say out loud because it is so taxing, right? So nutrition is the first place that I'm going to look. In the second place, the second thing that I'm going to say to that person is for every minute that you are spending running, you need to be spending 3 minutes in recovery. So whether that's I always go to laying in the hammock because I love laying in my hammock and it really like just is a really good mental reset for me in recovery and I just feels really great for me. So like laying in your hammock, sleeping, meal prepping, eating, like you have to be on top of those things. Like I really if you can't do that or you're unwilling to, like I mean best of luck. You know what I mean? But, like, you better be sleeping like it is your job, you better be eating like it is your job and recovering, right? So, like, with whatever's in your means. I know not everybody's gonna have the money to be, like, getting regular massages or this or that, but can we do a day of mobility? Can we, get a monthly massage if that's in somebody's budget? Are we making sure that we're taking rest days, right? Because I don't care how many miles you're training for, you need to be taking rest days, right? And so, making sure that there's not, like, a I think we talked about this on my podcast. There is the the unhealed trauma and endurance community. There's a lot of overlap. Let's call it a Venn diagram. And so if you're not like we need to be chasing these things for healthy reasons. And I won't say right or wrong reasons. I'm using the word healthy very intentional here because I literally feel sometimes that people are literally running from their trauma. So like are we doing this for a healthy reason or are we doing this because we hate ourselves? And you could apply that to anything. I'm not singling out endurance sports here, CrossFit, the way that you eat, right? Because people will shame their body into to quote unquote look a certain way in any sport, right? Or in
Mhm.
any type of exercise. And so we need to be having a healthy approach. So I'm also having that conversation with people. And doing what we can and really, really focusing on that nutrition and the rest of recovery because if that stuff's not in line, we're gonna. I mean, listen, like I'll continue to let you pay me money, but you're not gonna see any progress. And in a way that like we need to be paying it. Like if things are not going well and you are training for a big event and you don't want to stop, we can still see progress, right? There are still things that we can do. That's not what I meant when I said that, but you know, you have to be really, really into I mean, as you talked about on my podcast, like, it's a full-time job, like, for the recovery
It
stuff.
is. It is, and so then that brings me to my next question is, right, you said a chronic problem is that women do too much, like, no matter what you are, if you're it doesn't matter if you're an ultra runner, if you're a gymnast, or I don't know, you're doing
Even if
whatever you
you're
do.
yeah, yeah,
Yeah, like, it doesn't matter, like, women just tend to do too much, and I guess how do you encourage women? How do you yourself allow yourself to find rest and to rest? Because I know, like, I heard you say that and I was like, I
yeah,
struggle with that so much. Like, I
yeah,
will go out on like a long run and then I will come home and I will be on my feet for like still the rest of the day, like doing stuff. I'll go up to like, I'll do whatever. And then my boyfriend will be like, he's just sitting on the couch because he's like, "I just worked out for 3 hours, like, I'm going to lay down." And he's like, "I need to rest." And I'm like, why is he so much better at resting than me?"
Yeah. Yeah. So, I'm gonna really rein this back like a bunch of years ago, and then I promise to loop it in. And
That sounds good.
so women were told that they could do it all, that they could have a job and a family, and they did. And you know what they have now? They have autoimmune disease. Because here's what happened. In all seriousness,
Mhm.
women were told that they could do it all, so they went to college, they got a job, they climbed the corporate ladder, they had those kids, they got married, they have the picket fence, the golden retriever, and everything else, and they went to work. What changed for men in
Nothing.
general? And this does not make me that I am not someone who's sitting listen, I'm very pro capitalism, I'm very pro women, like, being driven and doing the thing, and also, like, I can tell you now working for myself and the hours that I keep and the things that I do now, like, I cannot imagine going back to a corporate job. I can't. I mean, there were a lot of reasons why it was making me sick, but I think that there is a big and I I'm not even I'm not religious. I'm not like, "Oh my god, the nuclear family," like, I'm not here to, like, push any kind of message. And also when I look at things objectively and I see what having 2 working parents has done to women's health, it's a factor for me, and I question it and I think about it, right? And again, this is not me saying that women can't have these things. I do think that they have to be more strategic about it, and I do think that they're and in some families, there may be a woman listening who they're like, "My husband does, like, all this shit," and I'm not saying all men that this isn't the situation for a lot of women, but I see both sides. I see women who they're like, "I literally do everything and my husband does nothing," and I
Mhm.
have women who they're like, "My husband's such a great partner. We split time with the kids, we split bedtimes," and, like, those women are doing a lot better, but at large, men continue to go to work and women will always be like, I have a lot of friends who are moms. Their kids just want them more. That's just how it is with children. And so, again, I know it might be a little more advanced. So, moving forward to like your question as to like how do I get people to like kind of reset their nervous system and rest and for myself. Number one for me, I for the most part am pretty strict with my phone and hours. I think the technology and blue light is a huge problem. I think that having access to everything that's going on in the world 24/7 is fucking killing people. And I mean that very seriously. We are not meant to see assassinations in real time. We are not meant to see all of the threats. We are not meant to see all of the this and that and people's reactions to this and that. And I heard on a podcast today the quicker the reaction to something and the sooner the information comes out about it, it's usually the furthest from the truth, and it's usually where people start screaming the loudest about, and we hear it and we see it constantly all the time, and I think that that is, a really important thing. I'm actually in the month of May, I'm giving away a brick device, if you rate and review my podcast.
Heck yeah, that's a good idea.
Yeah, well, one person will win, I'm not giving it to everybody, like, listen, I don't have
Yeah.
that much money. So I think that boundaries with technology are important. I think that having good boundaries with your sleep hygiene, if I had to pick one thing that is most important facet of health, it would be sleep, because it literally impacts everything. So making that it makes you more resilient. I know when I don't sleep well, like I'm bitchier, I'm shorter with people, I'm not nice, I can't think straight, I'm not as productive. Um, so making sure that I'm really resilient with that. I don't my nervous system doesn't get as activated in the day. I have really strict boundaries with work as well. Like I don't anymore every once in a while I'll work on the weekends, but I don't quite mind that because it's usually something quick. But I'm not on my computer late. I only message my clients on Tuesdays. And I do not look at that before that. And I think a lot of people have very poor boundaries with work. I think that taking home the laptop has also been a demise of our nervous systems because we can take it anywhere and work after the kids go to bed and just don't. Use your PTO, like, this isn't the how much can you work Olympics, okay? Use your PTO if you work a 9 to 5. I don't wanna if you come to me and you have 300 hours of PTO, I'm gonna tell you literally to take every single hour right now. Because why? Why is this it's like the trauma Olympics, like, well, this isn't the trauma Olympics, like, whose trauma is worse kind of thing, like, this isn't the work Olympics. Take your
Mhm.
PTO. And I think, I saw something ironically on the internet about how like little different day trips and like things that interrupt your normal life are like really good for your brain and your nervous system. And I think back to my friend Brenna. I was visiting her and we like took this really, really great day trip to Cooperstown. She lives in New York. And it was just like I felt so chill like that whole time. Like it was just so great. And so I think little things like that are, and listen, I realize that not everybody can afford a plane ticket, and just going to like, do you usually go to a farmer's market? Go to a farmer's market, right? But scheduling rest, taking regular vacation time, even if you can't afford to go anywhere, can take that time off and go to a local park and, shut your laptop for a week, and having boundaries with work, I think are just so, so, so important and so simple. Um, I think even sometimes like today I was really rushed and I could have done a better job about just taking a couple of breaths and getting outside. Like, I know I've kind of rambled through this and I really haven't been the cleanest about saying things, but I think we spend so much time inside. And I think that sunshine is really, really healing for our bodies and our systems and our health. And none of us get enough of it.
No, I mean, I agree with everything you said, like, even just, like, the trip thing that you said, I mean, the other week and I'm really lucky, and I do also feel like sometimes I need to caveat that with, like, not everyone has this opportunity, but even the other week, like, I have unlimited PTO, and I was like, it was, like, a beautiful day, I was, like, 70 degrees, and I was like, "I just don't wanna work today, and I wanna ride my bike." Now granted, like, had a really big work month in March and I was kinda burnt out and I was like, "I just need a day." So I just took the day off and I didn't it's not like I left, it's not like I went on a trip, I just took the day off because I wanted to take the day off, and I went on a long bike ride and it was beautiful and lovely, and, like, the next day my coworker's like, "Oh, like, what'd you do?" And I was like, "Oh, yeah, I just took the day off because I wanted to go ride my bike," and, like, I realize not everyone has that luxury, but, like, also finding spaces where, like, that does exist. Like, it does exist places that, like, you can work like, I do work a full-time 9 to 5 job, but I also work a full-time 9 to 5 job that, like, I love, and, like, I would be friends with every single one of my coworkers, and they really value mental health, and they value they're like, they always say, they're like, "What's the point of" like, is no, it was like, "It would be a shame to burn out if you love your because you love your job so much." So it was like, you love your job, so therefore take time
Yeah.
so that way you can come back and, like, feel refreshed and energized, and so I do think that that is such a big thing is that I think I felt guilty. There was a part of me that felt guilty for taking time off, and I was like, "No, like, why should I feel guilty?" Like
Yeah. Stop it.
and then we have the yeah, because then we're like, "Oh, I'm not good at my job," or "I'm not doing enough," and same thing with social media, it's so easy to look and see, like, this girl's running 7 marathons this year, like, what am I doing? And it's so easy to compare, which also
Yeah.
makes the, like, doing more. It's like, "Oh, I gotta
Yeah.
do more because I gotta keep up with this girl."
Yeah. Yeah. I
So
mean, it can be really dangerous. But yeah, I'm a big fan of like taking time off. And like for me too, like for people, if you work for yourself, like I would say too, like curating your schedule. Like I don't see clients in the morning because I don't want to. I love my job. I'm so passionate about what I do. I don't want to. So I don't. Like
mhm.
it's just that
Yeah.
easy, you know what I mean? And so and like I was just feeling like I had a lot going on the past 6 weeks, and I think I told you I was up at the Salt Lake City Expo
Mhm.
this at the marathon for the expo this past weekend, and I just had so much going on with like launching my HRT business and still working full time in my current business, and I run a practitioner facing business, and I have a podcast, and I'm slated to be on like 7 other podcasts by the end of June. And I just told my business manager, I was like, "Can you message people and tell people I'm not doing messaging next week?" That's it. Like, you can do things like that. Like, and for me too, in the work that I do, I think it's so important for me to be a good example. Like, there's a reason why I don't go to conventional medicine doctors because I'm gonna be a little bit controversial here as if I haven't been already, but like, I don't wanna go see someone that's 100 pounds overweight who skipped their breakfast and probably fell asleep watching Netflix trying to tell me how to be a healthy person. And so I really feel very strongly, and like, I'm not perfect, not at all, but I really put forth a strong effort, and I feel that it's important for me to set that example for my clients and my patients to be like, "Hey, listen, like, I'm not gonna ask you to do anything that I wouldn't be willing to do for myself if I had this issue." Right? And so not in a way that like I'm not some guru on a hill. Like I'm just an average everyday person who knows a lot of information about this stuff. But boundaries are one of the biggest things that my women struggle with and saying no. And so I think we started this with like, how do you get women from doing too fucking much, right? Like once you hit your 40s, like you give a lot less shits and you just say no and it's a complete sentence. And I feel like I was like that a lot of my life anyway, because listen, like I cut my father off like many, many years ago. So when you can cut your own blood off because they're an asshole, like there's not a lot that you can't do, right? Like and say no to. But I
Mhm.
realize that not everybody is like that. And so I think that leading by example with setting healthy boundaries is a really, really important thing that I do. Um, I feel really strongly about women being able to set boundaries, and so many
Mhm.
women feel like, oh well, I just have to. I have to say yes. I have to do this. I'm like, do you? Who has a fucking gun to your head? Who literally, what's the emergency? Like, I've seen a lot of reels make it into my way too. Again, it's funny we're talking about technology, but um, and it's just like people taking a deep breath and like saying to themselves, like, this is not an emergency. It's probably like no one's gonna die, you know? And I just think that
Mhm.
it's an important thing to remember is that like it's probably not that serious. No one's gonna die, and you can say no.
I love it, I love it. Well, I usually ask people what if they could give their younger selves a piece of advice, what would it
Mm.
be at the end of the podcast?
Oh.
But I don't know, I feel like you just gave us a lot of advice, but if you have something.
My younger self, oh boy. Ironically, it would probably be not to drink alcohol. Yeah, I did many a cake stands in my life. I went to college, like,
Mhm.
but I would probably I don't know. I also don't I don't like regrets either. Like everything kind of I don't everything happens for a reason. It's so corny, but yeah. And I would probably say like don't worry, like everything's going to work out. Like it's all going to be okay, you know? Yeah,
Well, I
I like
love
that
it.
better.
I love it. Well, thanks so much for coming on the podcast. It was lovely to
Thank you.
ask you
You
the
guys such
questions.
you asked such good questions too. This was so good. Hopefully your listeners don't hate me.
Thanks for listening to the Blue Rose Podcast. If you love this episode, please hit follow, leave a review, or send it to a friend who's building their own bold life. Keep trusting yourself, and I'll see you next week.